Feel free to ask questions, share this out. Let me know what you got going on today. And we're going to be finding out everything that Dr. Keiser has going on. Good morning. This is KHEA Radio, 99.5 FM. This is Kickstart. My name is Gardy, and I'm going to get my guest introduced, and then he can share his role. Dr. Keiser, how are you doing today?
I'm doing okay. How are you?
I'm doing, all things considered, I'm doing pretty good. It's almost the weekend. There's a lot of information coming at us really quickly. Dr. Keiser, can you share what your role is in the county, and what does that actually mean?
Sure. So I'm the local health authority for Galveston County. These is a position that every county has, and it's prescribed by law. And you have to be a licensed physician in the state of Texas. And my role really is to look out for the health of the public in Galveston County. So obviously with things like COVID, that means that we have a lot to do. So what we have done is we work with, first of all, we count cases. We try and make sure that we know how many cases are having and what the impact of that is. We work very closely with healthcare providers to make sure that their needs are being met in terms of being able to care for people as they get sick. We work very hard to roll out diagnostics through the county. And I'm very proud to say that we have a very robust testing program where anybody who wants to get a test can get one. And that is actually being sponsored by the county judge's office, Judge Mark Henry. And when we find individuals that are positive, we call them up. We try and we ask them about other people that they've been exposed to, so we can identify those people. And then when we find someone who's infected, we ask them to stay home. And that's probably the most important thing that we can do right now, is that people that know they're infected or even suspect they're infected, to have them limit their contact with other people. Once we know somebody's has the infection, we do daily wellness calls to make sure that they're doing okay. And sometimes we'll have to tell people, you don't sound so good. You need to go to the emergency room. We keep track of all the deaths when they're clusters, such as we had early on within the nursing homes. We work with those nursing homes to reduce the chance of having their patients get infected. And this is obviously our most vulnerable group. With the numbers rising, obviously, we're extremely busy.
Yes.
But it's interesting work, I have to say that.
Yes. You had mentioned that, anybody can get tested. Should everybody get tested? Should you only get tested if you have symptoms? What's your advice?
Well, I think it really depends on the situation. We don't want people just to get tested if they only have symptoms. If someone has a close contact, and a close contact means that they have been around someone who has COVID for greater than 15 minutes without a mask on, and at less than a distance of 6 feet. So, that's a lot of technical stuff, but basically that means, sitting in the same room with somebody for, having a conversation for 20 minutes over coffee. And if they have COVID, you should probably go ahead and get tested. If people have symptoms, they should go ahead and get tested. We offer different tests. We offer an antibody test, which tells people that they've been exposed to COVID, because a significant number of people can actually have asymptomatic infection. But that's not to diagnose the illness. That's mainly if you have the question, well, did I have it back in January or February? Or, 3 weeks ago, was that something that I thought was COVID? That's when you would get the antibody test. If you have symptoms, we would suggest that you get what's called the PCR test. And that's the test everybody hates. It's where you get a swab stuck in your nose. And then we send it off to the lab and get a result. It's actually not that bad of a test. I've had it done myself. And it wasn't so bad. But different people have different responses. My father-in-law, he complained for 2 weeks how awful it was. And my mother-in-law, his wife, just basically said, oh, it was kind of fun. So I think a lot of it has to do with individual reactions to the procedure.
Yeah. Right before we went on air, you said you've been really busy for 5 months. Can you describe, I guess, the roller coaster, the county, and our health journey as a whole the last 5 months?
Yeah. So in January, we got wind that these cases were coming, and I looked at these epidemic curves, and even though they were in China, it was January 20th, and it was the day that the first case was recognized in the United States. And I thought, oh my God, this is coming. And so we got together a small group of people and started working on planning and getting people aware of it. And So during February and the first part of March, we really spent a lot of time planning what are we going to do if we get a case of COVID. And then it was what are we going to do if we get 2 cases of COVID? And then what are we going to do if we get 20 cases of COVID? And then in March, the cases started coming. And so that was really very shocking. At one point, we found a nursing home that had over 90 cases in it. And we had to work very closely with the nursing homes and make sure that they were doing all the right things to keep the spread from getting farther out. We had to work with some healthcare facilities that really weren't prepared and were doing some things that could potentially put their employees and their patients at risk. We had to answer a lot of calls from the public, and I would say that then the shutdown happened, and when that happened, a few weeks later we started to see our cases decrease. So that by the first part of May, we had very few cases. We would only have a couple cases a day. And I was crossing my fingers and hoping, gee, I hope this is it. But sure enough, as things opened up, we start seeing more and more. And then every week since the first week of May, we've had more cases and more cases. A couple key things were, I think, Mother's Day, we started to see more cases. But the real issue, I believe, is when Memorial Day weekend. A lot of people just were so sick and tired of being locked up that they had to get out. And then the bars also opened up. And with them, we saw a lot of businesses that were not following the governor's guidelines. And I think that's the real issue. It isn't so much that we opened up, it's that in the opening, people were just not following the guidelines. And consequently, we've seen a lot of people get infected. The last few weeks, we've seen a lot of young people. Our average age last week was less than 30 in terms of people getting infected. So it's young folks out there. So that's the good news. We don't expect them to get that sick, but the problem is they can take it home to their parents or grandparents, and then those people get sick. We're already seeing the hospitalization rates rise. They're starting to go up, and we're worried that over the next couple of weeks, as the older people start getting sick, we will start seeing a lot of people ending up in the hospital and start having more deaths. So that's kind of where we are right now. I think we're at a critical point. I think if we can get people to do what they need to do, we may be able to turn this around again.
Okay, so we have some questions that are coming in, and I'm going to ask those. But I have one I just want to clarify, I guess. I saw the Galveston County Health District put something out that said like the first 3 months, it took the first 3 months to get about 1,000 cases, and then in the past 2 weeks, we've had our second 1,000 cases. Is that
right.
accurate?
Yeah, that's right. That's right. I mean, isn't that amazing? Every last week we had over 500 cases. This week already we have over 600 cases.
Wow.
We'll probably top around 700 cases. And so this is a part of an epidemic curve that they call exponential growth or an asymptotic rise. And basically what it means, it's like a rocket taking off. Now, how high it's going to go, we don't know. All right. And that's going to be the real key. And if we can get people to change the way that they're doing things, we may start to see that number bend down again, and then it'll become much more controllable.
Okay, this is a question. This is from Miss Walker. She asked, why is there such a big contrast in the number of hospitalizations in Harris and Galveston County?
Yeah, well, first of all, Harrison is much more densely populated than Galveston. And quite frankly, Harris is a little ahead of us in terms of both the percent people positive and the numbers of people that are being hospitalized. We publish a number that doesn't represent say, for example, that number represents the number of COVID positive people as of yesterday that are Galveston County residents that are hospitalized. And that's one of the key things people need to realize is that the way the state requires us to report things, we report on Galveston County residents. That doesn't mean, for example, though, that at UTMB or at Mainland Hospital, that there aren't people who are not Galveston County residents who are hospitalized. And we're seeing those numbers going up as well. So what we actually have to do is we, as monitoring the situation, we look at a wide variety of sources. We don't just look at what our county residents are doing. We also look at what are the hospitalization rates overall, and then also what are other places looking like, because that tells us what our future might look like.
Wow. So earlier today, Texas Governor Greg Abbott, he made an order that by noon today that I think all bars have to close down and restaurants can only be at 50% capacity. Is that the right step, a step in the right direction to get this under control?
Yeah, I think so. I wasn't aware that happened, but I'm not surprised that came. I would say that as ever since the opening up, I have not locked myself in my house. I've gone around and I've visited, various eating establishments and entertaining establishments. And the problem is that there are some places that are doing it absolutely right, and there are others that just aren't doing it at all. And which is really unfortunate, because what's happening is that some people are flocking to those places, particularly some of the bars, and where there's actually no effort to keep away from people, and that's where we're seeing a lot of spread. So I think the governor has finally gotten frustrated with the fact that people aren't doing what they've asked him to do, and he feels like he needs to shut down on that. Also, considering that it's the young people that's driving these the epidemic, and it's more the young people that are going to the bars, I think that is probably a good thing as well.
So as an individual, what kind of precautions should I be taking, you be taking, and then what kind of precautions could you recommend to a business like a restaurant or even a gas station, anybody?
Yeah, sure. And it's interesting. It doesn't, so from a business point of view, it doesn't take a lot of effort. You'd think it might. But I've seen all sorts of very creative ways of making sure people social distancing. For those of us that are individuals, I think it's what we've been saying all along. It's when you go out, wear a mask. And I think that's very important, because my wearing a mask protects you and your wearing a mask protects me. And if we both wear a mask and one of us has COVID, the chances of one of us getting it is about 1 in 1,000. So we can put a real dent in it that way. Washing your hands, obviously, that remains to be a very, very big issue. And then being thoughtful about when you go out and where you go out. We can't keep the entire population under lock and key forever. So we do have to allow people to go out and do their business. But we would really ask people to be thoughtful about it. So, so when you go to a place, if you go to a grocery store, you go to a gas station, you go to something else, and there's choke points and people are lining up and nobody's staying 6 feet apart, nobody's wearing masks, and that's probably not a good place to go. In terms of businesses, what they can do, the guidelines are out there, and they're really very clear. For restaurants, 50% means that half of your tables are not in use, that your staff is wearing masks and gloves, that you use paper menus, and that you have hand sanitizer. And the thing that we would ask people is, don't let people into your business if they're not wearing a mask. You don't want them in there contaminating, your staff and your other customers as well. So I think those are the main things people can do. And I'll tell you, I was actually in a gas station. I needed to get gas. It was this little gas station. It didn't have a lot of fancy equipment. It just had some X's on the floor, and it had a plastic shield in front of the clerk. And everybody was staying 6 feet apart, and somebody got in line, and boy, that clerk chewed him out. So you can do this, and if everybody does it, I think we will be in a much better state than we are right now.
Yeah, I think what's confusing to a lot of people, I know I've caught myself being confused, is that the information changes. Hey, you don't need to wear a mask. Okay, maybe we should wear a mask. Maybe it doesn't stay on surfaces as much. It just changes. Is that because it's such a new thing that we're kind of figuring it as we go?
Oh, yeah. One, we're figuring it out as we go, and the situation changes, too. So initially what was happening with masks was that everybody was buying masks, and healthcare providers didn't have masks to work when they were seeing people that were really sick, and the healthcare workers were actually getting sick because they didn't know the proper thing. So that's why the word went out, please don't hoard masks. But now, there's been a lot of back and forth about masks, but now I think it's really very, very clear that just any kind of face covering, if you have the infection, if you have a face covering, you're not likely to give it to someone else. And a face covering doesn't necessarily mean a surgical mask or an N95 mask. It can be something as simple as a bandana. That's fine.
Like my bandana. That's what I've been wearing.
Yeah, I think that's fine. And people are being real creative about it, and some people are coming up with designer masks and things that are really cool. And so I think the more we can get people to do this, the less people will be getting sick from it.
Right now it's 10:16 a.m. This is KHEARadio.com, 99.5 FM. It's Kickstart. My name is Gardy. I'm talking to Dr. Philip Keiser. He's the Galveston County Health Authority for our area. If you have any questions and you're watching on social media, feel free to ask. We stream live on YouTube, on Facebook, and we're also live on our FM and everywhere else. So there's a lot of opportunity to check out KHEA. Dr. Keiser, how long have you been in this role, and what have you done in the past that makes you, the expert?
Okay. Well, I started becoming the local health authority in 2016, but I'm an internist and infectious disease specialist, and I've worked with HIV, I've worked with tuberculosis, I have worked all over the world, and spent a lot of time in sub-Saharan Africa as well as in the United States and Dallas. I'm also a professor of medicine at the University of Texas Medical Branch, and when I started off this role in 2016, my initial didn't expect it to be anything busy like this, and thought that, we'll take care of the people who have tuberculosis and vaccine programs and other stuff and a lot of very routine things. And then we had things like Harvey hit and had other outbreaks and other types of things. So, it's very much a learn on the job type of situation. With regard to COVID, nobody knew what we're doing, and I'm still not sure we know what we're doing. And I think we learn more and more every day, and we get better at it. And but at the when this thing's all over, some years from now, scientists and historians will study this, and they will point out all of our flaws and errors and how we could have done things better. And we know this. We're just trying to do the best we can. And the most important thing is to recognize when you've made a mistake and change it.
Can you speak on like hospitals being filled up, if there's rooms in beds? Is that do you have information on that?
Yeah. So in Houston, the hospitals are getting filled, and in terms of they're close to 100% capacity with their ICUs, so they're getting nervous. But they have expansion capabilities, and the same is true as at UTMB. We are not filled at UTMB or at Mainland Hospital, and there is expansion capability. So there are other beds, there are ventilators available. All of the things that people were worried about is that we wouldn't have a ventilator to use if we need. We wouldn't have a bed to put people in. We have that. One of the biggest concerns is staffing, trying to make sure that as we do surge that we have enough staff, and not just staff for a short term, but staff that can take care of people for a long time, because it looks like this may be a long haul. So right now we're okay. What that is going to look like in 2 weeks or 4 weeks is anybody's guess.
Okay. Can you somebody just asked a question here, but right now I'm talking to Dr. Philip Keiser on KHEA. We're also streaming live on I-45 now. So again, feel free to ask any questions that you may have. Dr. Keiser, I've been wearing this mask. I've been trying to social distance. I have a family, at home. I still come up here to KHEA to do interviews. What kind of precautions should I be taking with my kids? I have 3 young children.
Yeah, well, fortunately, your kids are not likely to have a problem, and that's probably one of the good news about this. Typically when we see these types of infections, they affect young children and elderly, and this one seems to spare most of the young children. But the bottom line is do everything that we've been saying to do. So, in your workplace, if you're close to other people, you should be wearing masks. You should be washing your hands. You should be mindful of where you go and where you take your kids. If you take your kids outside, that's okay. And you don't take them to the playground, that's okay as well. You want to take them to something where they are in organized sports and everybody's tightly packed together. That may not be a good idea. And right now, the nation is struggling with what to do about organized sports, and no one has a good answer to that. So if you want to be completely safe, maybe sit that out for a period of time.
Okay. And what are the numbers saying? I think the Galveston County Health District is doing a great job with the charts and the graphics and making it easy to understand. What are those saying for our area? Can you kind of describe that?
Yeah, what it says is that the numbers of cases have increased dramatically. Like you had said earlier, we had over 1,000 cases in the last 2.5 weeks, and we expect to continue to have more at the rate that we're going. The good news is then it tells us that it's mostly younger people. If you look at those graphs, you look at the bars that say, between 20 and 30 and between 30 and 40, those are not only the largest ones right now, they're the ones that are growing the fastest. And so what I think it is that, everybody's tired of being locked up. Everybody wants to go out and do something. And I think the younger folks are feeling like, well, if I get it, it's not going to harm me. So what's the big deal? And unfortunately, that just contributes to the spread. And our concern is that we're going to see this over the next couple of weeks spill into the older populations, which are at higher risk of getting sick and dying.
Yeah. That's what I've seen. Like, the survival rate is is what it is for here. But I guess the concern shouldn't be if I'm 30, I'm in my 30s right now. It's not me, it's my grandparents, right?
Right, exactly. And so so imagine that if you went out and it's Friday night and you wanted to kick back and you wanted to go to a place that's say like on the beach or in Kemah and hang out with folks, and you accidentally get infected there, and then next weekend it's Grandpa's birthday, and you can't miss that, right?
Right.
And you go there, and then not only does he get sick, but the 6 or 7 other people get sick, and we've seen this. And we actually had someone die at UTMB last week, whose every member of that family died. It was like 4 of them, and it was a father, a mother, daughter, and son, and they were all in their 40s. The kids were, and they all died. They didn't all die at UTMB, but we see clusters, and that's the sad thing about this. People go around, well, I don't know anybody that's had it. And that's because it hasn't gotten into your cluster, into your community, into your family. And so you don't know anybody that's had it. But when it gets in, then it affects everybody. As we do contact tracing, we find a case, and it may be a 20-year-old. And we call them up and we say, hey, you're positive. Who do you live with? And they go, well, I live with my mom and my dad and my sister. And, and then I was, we had a party. And then we investigate them all, and we find like 10 or 15 people from that. So that's why it's very, very important for people to be mindful of where they go, because they go out and then they bring it back home. And when they bring it back home, a lot of people get infected at home.
Can you speak on COVID-19 being spread through like surfaces and then maybe like open air situations, being outside?
Yeah. So it's become pretty clear now that the number one way is through what we call droplets, which is where people cough. And to use a 5-year-old analogy, it's basically little balls of snot, and they spread all over the place, and that's where about 6 feet distancing comes in, because that's about the maximum distance that these little balls can travel. And then when that happens, if you breathe that in, which can happen, you're more likely to get infected. Aerosol in and above itself, meaning that it's just floating out of my nose, it's much less of an issue. So if you're walking down the street and someone passes by and they have it, can you get infected that way? Yeah, but it's pretty uncommon. Again, surfaces are not as big a deal as we thought they would be. And, for a while, people were worried about, what about my mail? What about packages from Amazon? Oh, I got a package from China. Am I going to get COVID from it? And it turns out the answer to most of those things is no. We do recommend wiping down surfaces that people are going to use a lot, and things that people touch. Particularly businesses. Things like doorknobs and areas where people might push buttons and things like that. But the primary way of it getting spread is through that droplet precaution, which is somebody who has it and who is doing a little bit of sneezing or a little bit of coughing, and that's how it primarily gets spread.
So where can people get tested? Let's say they have symptoms, or they've been in the vicinity of somebody who did test positive. Where can they get tested? Who can they call? Is it free? What's the deal with it?
Yeah. So if you have insurance, your insurance company will pay for it. All right. And basically any doctor's office, any hospital, any emergency room, a lot of the urgent care centers have figured out a way that they can make a little money off of this, and so they're offering drive-through testing or one-stop shop testing available. Coastal Health and Wellness, if you don't have any funding, which is the local federally qualified health system, can do testing for you. UTMB does testing. Most places are doing it by appointment at this point. If you, the county is paying for testing for any county resident or for people who work in Galveston County, and there's a number on the county website, as well as on on the county judge's website, as well as on the website for the Galveston County Health District, where you can call, and that you can get that without regard to your ability to pay. Anybody can get that. If you do have insurance and you call that number, they will ask you to use your insurance, because, quite frankly, we're trying to spread the dollars out as much as possible. And so if insurance will pay for it, we'd prefer to do it that way.
Here's another question that came in on Facebook. Has the learning curve improved clinically as far as the treatments? If the survival rates better? And has any new news as far as vaccines go?
Yeah. So have we gotten better at treating it? The answer is absolutely. I think one of the most important things I think we've learned is that it's better not to put people on ventilators too early. And that's in marked contrast to some other diseases that affect the lungs, where putting people on a ventilator earlier, they get better survival. In this case, that's not a good idea. So the second thing is having people lie down, what's called a prone position, basically like you were on a massage table and your face is going down through the hole. And that allows things to drain. Having good oxygen and good hydration are all things that have helped. We have a drug called remdesivir. It's still technically an experimental drug, but it's widely available. And we have some here in the county that we use for patients. And the real trick is giving it to them at the right time. It's you don't want to give it to them too early, and you don't want to give it to them too late. The third thing is that there's a drug called dexamethasone, which is basically it's an anti-inflammatory drug that we use for a variety of conditions. If people are really sick, has also shown to have some benefit. So we put all those things together, and I think our ability to manage this disease has gotten a lot better. The other thing that I think it's hard to quantify, but I think it's really true, is the most important thing is we now have a seasoned healthcare team. Our team has been dealing with this illness for, since March, and they've seen lots of people with COVID. And I think that experience really translates into taking better care of folks. As far as the vaccine goes, your guess is as good as mine as to when we will have a vaccine available. I'm hopeful that the optimists are right, and that we will have a vaccine that we'll be able to use either by late fall or early next year. But I wouldn't be surprised if it doesn't happen. These things can be quite difficult. The good news is that the federal government really is pulling out all the stops in developing a vaccine. They're pouring a lot of money into it, and they are streamlining the regulatory processes to make sure that that things that would have taken years in terms of the testing to prove that something's safe only take months by getting rid of a lot of the bureaucratic holdups there. So we'll see with regard to the vaccine.
So if it was, let's say it was August right now and things were the exact same, would you recommend that the kids go back to school, or there's precautions they can take to be able to still learn?
Yeah. I mean, if you would ask me that today, should kids go back to school, I'd say no. And then the reason why is that the numbers are going up. If we can get to a place where we know numbers are stable or numbers are going down, then I think it could be reasonable to send kids back to school. But right now, I really worry about adding that extra dimension. You're going to have a whole bunch of kids in together, and I know the schools are very worried about that. We've worked a lot with them to help them develop plans on opening, but it's very worrisome. And again, it's the same issue. The kids go to school, they get sick, they're not that bad, but then they take it home and they give it to their parents or their grandparents, or they give it to the teachers who may be at risk. And so that's our big concern.
Right now, I'm talking to Dr. Philip Keiser. He's the Galveston County Health Authority. I think there's a fine line. At least I try and walk personally, not being afraid like of everything, but also taking precautions and being careful. And it's a interesting balance.
Yeah, it's difficult, and I've had my days where I've been wanting to hide under the bed, and I've had my days where I just looked at the Gulf of Mexico and wanted just to walk on the beach and walk right in, and so it is difficult, and that's why I keep using this term: be mindful, think about what you're doing. It doesn't mean you have to be in prison and live in fear, but it does mean that you can take reasonable precautions. We put on seatbelts without even thinking about it, right? And we drive cars with airbags, and we know they're there. And there's so many things in our lives that we do without even thinking about, because we know that if we were to do something different, it would be dangerous for us. And that's where we are right now. Think about getting too close in line. Think about wearing a mask. Think about, wait a minute, that they got all those people in there and nobody's social distancing. Do I really want to go in there? And I would say the answer should be no. On the other hand, if you go out and look around, you'll find plenty of restaurants and plenty of establishments that are working very hard to make sure everybody's safe. And I think we should reward them for their efforts. So it is a hard thing to do. And like everybody else, I have my good days and bad days.
Dr. Keiser, thank you for joining us today. Is there anything else you would like to share this morning?
I think the main thing is let's get back to the basics, okay? It's scary right now seeing those numbers go up, and we are very concerned. But I think the next couple of weeks are really going to be critical. So if we can get everybody to do their part and have everybody do what we ask them to do in terms of masking and in terms of being careful where they go and how far apart they stay from each other, I'm hopeful we can turn this around.
This is KHEA Radio, 99.5 FM.